Did you know that 1 out of every 3 individuals is likely to face cancer during their lifetime? What's even more alarming is that millions of cases are detected too late each year simply because people miss the early warning signs. According to data from the American Cancer Society, diagnosing cancer in its early stages, such as stage 1, can lead to survival rates exceeding 90% for many common types. By contrast, a stage 4 diagnosis can see survival rates plummet to below 20%. In this video, we'll uncover 8 subtle signs your body might use to signal cancer in its early stages. These aren't the glaring symptoms everyone talks about. They're quiet, often overlooked hints that something may be wrong. Recognizing them early could be a lifesaver. Now, you might be thinking, every small issue feels like it could be cancer if I read enough online. That's precisely why this video stands out. We'll cover scientifically validated warning signs, steering clear of myths or unfounded fears. These are symptoms that have helped thousands of people seek early medical attention when treatments are most effective. So, stick around, because this isn't about causing panic. It's about giving you the knowledge to take proactive steps for your health. And at the end of this video, I'll point you to a couple of other in-depth resources you may want to explore for further insights. Let's dive into the 8 early warning signs you should never ignore. Number 1. Persistent bone discomfort. One of the most overlooked indicators of potential cancer is ongoing bone pain. Unlike temporary soreness caused by physical activity or minor injuries, cancer-related bone pain tends to get progressively worse, often intensifying during nighttime. Cancers that originate in or metastasize to the bones disrupt normal bone tissue, leading to a deep, aching pain that becomes harder to manage over time. Primary bone cancers, like osteosarcoma, often target the long bones in your arms or legs. Initially, it might feel like a pulled muscle or mild sprain, but the discomfort gradually becomes constant and severe. Patients often describe it as a throbbing or deep ache that doesn't respond well to typical pain relievers. If you experience persistent bone pain alongside swelling, tenderness, or unexplained fractures, it's essential to consult a doctor promptly. Early detection greatly improves the chances of successful treatment. Number 2. Persistent eye pain or vision disturbances. Your eyes can provide vital clues about your overall health, including warning signs of cancer. Ocular melanoma, though rare, is the most prevalent form of primary eye cancer in adults. Symptoms often start subtly, such as blurry vision that doesn't improve with corrective lenses or unusual flashes of light unrelated to migraines. A particularly worrisome symptom is the appearance of a dark spot on the iris that gradually changes in size or color. Advanced tools like ophthalmoscopy allow doctors to examine internal eye structures for abnormalities. Individuals with light-colored eyes or fair skin are more susceptible to this type of cancer. If you notice persistent eye discomfort, vision changes, or unusual spots, schedule an eye exam without delay. Early diagnosis could save your vision and your life. Number 3. Unusual skin changes or rashes. Certain skin changes can signal underlying health issues, including cancer. For example, leukemia, which affects blood-forming tissues, can manifest through distinctive skin symptoms often mistaken for harmless conditions. A classic sign is petechiae eye, small, round spots caused by a lack of platelets. These spots, typically red, purple, or brown, do not blanch when pressed and tend to cluster in areas like the ankles or under tight clothing. Unlike ordinary rashes, these marks persist and may accompany symptoms like unexplained bruising or bleeding. If you spot these changes, it's critical to seek medical advice. Number 4. Nail discoloration or changes. Subungual melanoma is a rare but serious type of skin cancer that develops beneath the nails. It often appears as a dark stripe running vertically along the nail, known as melanonychia striata. What differentiates this from normal pigmentation is that cancerous streaks often appear suddenly and grow over time, exhibit varying shades of color, or have blurry edges. If the pigmentation extends beyond the nail bed to the surrounding skin, Hutchinson's sign, or if you experience pain, bleeding, or nail splitting, seek immediate medical evaluation. Number 5. Profuse night sweats. Night sweats that leave you drenched may point to something beyond a warm room. When these episodes occur consistently without an identifiable cause, they could signal lymphoma. Such sweats often come with other symptoms, like unexplained weight loss or recurring fevers. They occur because your immune system is working overtime to combat abnormal cells. If you wake up drenched multiple nights a week, it's time to consult your healthcare provider. Number 6. Persistent heartburn. Chronic heartburn, or gastroesophageal reflux disease, GERD, might seem trivial, but when it doesn't improve with lifestyle changes or medication, it can be a red flag for esophageal cancer. Warning signs include difficulty swallowing, food feeling stuck in your throat, or unexpected weight loss. If heartburn persists for more than 3 weeks despite treatment, consult a doctor for further evaluation. Number 7. Sudden jaundice. Jaundice, characterized by yellowing of the skin and whites of the eyes, can be an early sign of pancreatic or liver cancer. Other accompanying symptoms, such as dark urine, pale stools, or upper abdominal pain, further highlight the need for immediate medical attention. Number 8. Persistent or unexplained fever. A fever that lingers or keeps returning without an apparent reason could be an early sign of blood cancers, such as leukemia or lymphoma. Unlike typical fevers caused by infections, cancer-related fevers often follow a distinct pattern and may coincide with night sweats or sudden weight loss. If a fever persists beyond 2 weeks, don't delay seeking medical advice. Number 9. Persistent mouth sores or unusual oral symptoms. Mouth sores that don't heal within 2 weeks, persistent pain in the mouth or throat, or unusual patches inside the mouth can be early signs of oral cancer. Look out for white or red patches on the gums, tongue, or lining of the mouth, persistent hoarseness, or a feeling of something stuck in your throat, difficulty chewing, swallowing, or moving your jaw or tongue. Smokers, heavy alcohol consumers, and individuals with HPV are at a higher risk for oral cancers. Regular dental checkups can help catch these issues early. If you notice persistent symptoms, consult a doctor or dentist immediately to rule out serious conditions. Recognizing these warning signs early can make all the difference. While these symptoms don't automatically mean you have cancer, ignoring them could lead to delays in crucial treatment. If you found this information valuable, please give this video a thumbs up and share it with someone who might need it. Don't forget to subscribe for more life-saving health tips.